Infertility is a struggle for many, many women. You might be wondering, what can an interventional radiologist do to help? Sometimes when someone has had any infections in their pelvis or something called pelvic inflammatory disease, it could often be misdiagnosed as a urinary tract infection or a UTI. But sometimes if there's persistent symptoms, a woman may later be diagnosed with something called pelvic inflammatory syndrome or pelvic inflammatory disease. When that happens, it can cause scarring in the part of the uterus where the egg has to travel in order to get fertilized, or the fallopian tubes. This is really important for everyone to know because if someone's diagnosed with fallopian tube occlusion, or if your fallopian tube is closed up, that may be a cause of infertility. It's not the cause of all infertility, but it's one of the causes. If someone's diagnosed with a fallopian tube issue, we can do a procedure called fallopian tube recanalization. It's a procedure where we inject a little bit of contrast into the uterus to outline the shape of the uterus and the path out. We can take a small wire to open up the tube. And that has been successful in a lot of cases. Usually we time it with the cycle. So you'll come in for an appointment and we can have further discussion. If you're struggling with infertility and you have been diagnosed with an occluded or obstructed fallopian tube, ask your doctor for a referral to interventional radiology. And what if you've been struggling with infertility and all the other diagnoses don't seem to make sense, or they've gone through a lot of other causes of infertility, such as low egg reserve or other things? You might ask for an examination, a pelvic examination, to see if the fallopian tubes are closed. The way to do that is through something called a diagnostic hysterogram. So it's contrast that's injected into the uterus to see if the tubes are open. If they're not open, then once we have this information, we can do a follow-up procedure to do a fallopian tube recanalization. So if you're struggling with infertility and all the other diagnoses have been excluded, you can ask your doctor if maybe you might have a fallopian tube issue. And if you do, a radiologist can help.